we want to bring the holistic, cost-effective, personalized healthcare solutions to every child. How we started? We started with newborn, and this is the first device we designed and built. It's a phototherapy device for newborn jaundice. And many already know 60% averagely, 60% newborn have clinical jaundice, and 10% of them need the blue light treatment. But it is very stressful in the bright environment and disrupt the parent-infant bonding. When my nephew was born, my family has to, watch him through the windows, cannot hold him. This actually negatively impact the neurodevelopment of the newborn. And the existing solutions are all expensive, like $4,000, $3,000 each device. So we want to solve this problem. I'm an engineer, so I thought, okay, I don't like it. I need to solve this. And this is the device we came up with. It's in swaddle, and it's no eye protector needed. Baby is not, naked. And there we have the caretaker in our mind as well. So when we do kangaroo care, the cover can actually protect the caretakers. So look at this solution, why we call this a novel solution. So many baby blankets in the market. So it's in 0 to 100 irradiance intensity. It's very flexible. You can set it up based on the prescription. And the coverage is back and front. It's the largest in the market. And it's safer for the baby and the caretakers. And of course, it's parent-infant bonding promoted. So it's battery-powered. Definitely you could call it mobile, like a mobile phone. And it's remotely monitored. We have different sensors built in, monitor the temperature, humidity. Even when you take the baby out of the swaddle, we're going to alert you. So you have to make sure it's continuous treated based on the prescription. And if it's reached to the temperature threshold, the LED panel inside will be turned off automatically. So it's a smart control. And also we have the second device, coming, have a real-time monitoring for TCB level. So from the baby born to the treatment and to after discharge, we have a device to monitor the baby's status. It is affordable. It's significantly cheaper than the devices in the market. And you can ask me the price after the talk. Yeah. So I already talked about these specs. It's going to be in our training menu, guide, label, and you will see our device on our website soon. We're currently undergoing FDA right now. So this is the market. The addressable market is huge because we all know the readmission of newborn jaundice problem costs a lot. It's about 1.5 to 2 billion per year. It's a really heavy burden to our healthcare system, and 50% of our children in the United States covered by Medicaid. So our next generation cannot afford babies. And the other higher populations, like foreign countries like Asia, Africa, Middle East overlap the area, they have a higher frequency, higher population impacted by newborn jaundice. So we want to push this device to as much as possible, and we expect our FDA approval in Q1 next year. And before we push the device to home care, which we all share the same vision that home care is better, we need physicians' buy-in. So we submitted SBIR grant to NIH in April. We work with Texas Children's U New Haven to do some, like co-piloting work. After the physicians buy-in, we hope that, physicians can feel comfortable to prescribe these devices to home care. And at the same time, we want to talk to, larger population. We are working with Next 360 and UNICEF. Next 360 covers 50% of newborns in Africa. They have a high demand for cheap, accessible solutions for newborn jaundice, especially the kangaroo care, which can reduce 15% death rate in the middle and low income countries. And further down, we are going to cover different areas like European, other Asian countries. So globally, the higher populations impacted, averagely 18%, need the treatment because of the higher population impacted in middle and low-income countries. This is our team. The engineering production team led by me has more than 90 years experience in product development. And also we have serious entrepreneurs led 2 IPOs in past. And we have a diversified advisory board who, for example, created 4 medical device companies. 2 of them acquired by Boston Scientific. We have previous CEO for Children's Hospital. We have general partners from Deloitte, investment banking, neonatologists, pediatricians. So this is a roadmap. Basically, we had a pre-sub FDA meeting on May 22nd. We got very positive feedback. The call for action. We actually work with Texas Children New Haven for our NIH Direct to Phase 2 grant. We got a pretty good impact score, and we are waiting for the final call. And the second device actually tackled every nurse and physicians, especially we can monitor them after we send the babies home to prevent readmission, to look at the rising trend on the bilirubin level, right? So I'm here for collaborate with new devices in our next pipeline, and we can do the same with Texas Children like New Haven, same thing. And also, besides co-piloting, we are looking for distribution, early contract. Also, if there is investor online watching, we'll welcome investment for this round. We're going to close next month. Thank you very much.